everybody, Dr. Monica Du here. Hope you all are doing well. I wanted to go ahead and talk about a very important topic, one that unfortunately we do see within our children, and some of you may even know some adults that have gone through this as a child or teenager, even young adult, and even in their adult life. These things can still happen, and that is the topic of physical and verbal abuse. You know, when we are maltreated, mishandled, and just, really harmed by someone else, whether it be through words or bodily contact, physical contact, this is something that can harm us in the physical portion of ourselves and also even mentally. This is something that can be lifelong and lasting and harmful for us in just our total well-being. I wanted to give you a few statistics to just show you how marked it is in our world today. You know, physical and verbal abuse occurs more than you and I think. The Child Protective Services actually investigate possible or potential cases of abuse, even close to 2 million per year in the United States. And greater than 650,000 U.S. children are abused per year. And unfortunately, greater than 1,500 children actually pass away as a result of the abuse that they have succumbed to. So this is something very important for us to be aware of and just know what to look for and what to do if ever we suspect something like this in anyone. So this is why I wanted to talk to you about this today. What kind of things or red flag signs are important for us to be aware of? One, of course, any unexplained physical harm, whether it be bruising, cuts, just trauma to the body that just cannot be explained. We should look into it. And these are things that our teachers might see, of course, doctors may see when they examine patients, or you might even see it in a neighbor's child or a family member. If you see unexplained bruising, if you have a suspicion and it's just not really a rhyme or reason, especially in small infants or children that are not able yet to walk around, they're not very mobile, bruising and trauma should not be happening to them. They are not mobile, they're not walking around. It would be difficult for them to get injured in severe manners unless something is happening. Of course, sometimes children have falls and have cuts and scrapes. So I'm not referring to this, but unusual pattern bruises in a pattern, marks on the body that are in a particular pattern that normally would not occur with just a fall. This may indicate to you that something is going on to this child. So, be aware. Of course, if someone comes with multiple injuries, or you knew that they had multiple internal injuries, fractures that cannot be explained, they seem unkempt, is another thing, or disheveled. They just don't seem very clean when you see them. They just don't seem right. In other words, they may be very withdrawn or sad. They don't seem like a typical child. If you are a teacher, ask them, how are they doing in their home life? Ask them if they feel safe at home, if you're a medical provider. And of course, we are trained also in medicine to detect certain things on our exam and to be able to pick up on the little cues that sometimes we may miss. We are trained to look into these things. So of course, medical providers need to be more in tune and aware of what to look out for. So very, very important. Some other things that I wanted to go into as well is, if you find that when you speak with a parent per se or the child's caregiver, that they really don't have a good explanation, and this is specifically for healthcare professionals, healthcare providers. Their explanations just don't seem right, just doesn't make sense, it's just not in line with the mode of injury, then you may need to do a little bit more investigation, because you are protecting somebody. Don't be afraid to at least make mention of it to the appropriate authorities, so that there can be an investigation at least. If nothing comes out of it, then at least you know that you've done your part. But don't be silent if you have a sneaky suspicion, if you feel like something is not right, with the child and they have unexplained injuries, especially, like I said, in those that are young, that are not mobile as yet. Speak up about it. Don't be afraid, because you may actually save a life. And I have seen it happen many, many times. Other things to be aware of that sometimes we are a little bit afraid to talk about is the sexual abuse that can also be happening beyond, of course, the traumatic and bodily abuse that I was mentioning. But sexual abuse you may not always see. So some people are thinking that, if someone is sexually harmed, you might see something present, of course, in the private areas if you're a parent. But you know what? You might not see anything, actually. And the sexual abuse can be occurring over long periods of time in a small, little ways, building up. And I'm so sad to say, but oftentimes sexual abuse occurs in families, between well-known family members that your children may even trust, or beyond family members, in authorities, adult authorities that your children also trust and that you trust. So, always just keep a watch on your children. Don't trust that others will do this for you. We don't know the mental state of everyone. We cannot tell by speaking with them. So you cannot definitely 100% trust people to take care of your children if you are not around. And, in life, sometimes we have to work. We have to bring our children to others to help take care of them while they're away. But just be as involved as you can. Come on in sometimes. Come and look for your children at an unplanned time. See what's going on. Be around. Let those that are taking care of your children know that you might pop in at any time. Have the kind of unexpected element of your presence, because the more you are away, the more predators that physically abuse and sexually abuse are comfortable in doing what they are doing, because they feel no one will see and no one will know, because they are so well trusted. So it's just so important, such an unfortunate thing that I see, but definitely many of the cases of abuse happen between family members and children. So, just be aware. The more awareness we have, the better able we are to prevent things such as these and to protect our children for the long term. Another important point is our vulnerable populations. Children that may have mental disabilities, disabled persons, those that are not able to care for themselves, they are at risk for being physically and sexually, verbally, mentally abused. So, keep a watch out for them too. If you see something suspicious, something is not looking right, they're coming in looking disheveled, they're having injuries that are not explained, just delve into it and see. It's better for someone to investigate than not. And if it is a caring parent, they would not mind if there was an investigation, because they care for their child and they want what's best for them. And sometimes people just actually need a little bit of help. So an investigation does not always mean that someone will be punished. Sometimes it can actually bring about help that was needed that would not have been obtained if someone hadn't, went ahead and made a call. And a call can be made, of course, to Child Protective Services, Department of Family Services. There are different services in each state that deal with physical abuse, sexual abuse cases. So you find out who is there in your region and reach out to them if you feel like someone may be in need of help. It doesn't hurt. Another point is that sometimes even parents themselves are in a very dangerous situation, and then of course their children are suffering from it. So actually, in fact, you may be saving multiple lives, including the parents that sometimes are afraid to get out of a dangerous situation. So very, very, very important. So these are some of the things I wanted to cover in terms of some of the red flag signs, and in terms of trusting your heart. If you feel like something is not right, let someone know. One more point that I can think of as well too before I close out is that sometimes children will start to act out in a certain way because of what they have experienced. So if you see a little child doing something that is not in line with their developmental stage, for example, acting out sexual behavior or very aggressive behavior, very vile language, sometimes you have to go ahead and look into the situation. Where are these exposures coming from? They don't just learn them on their own. They may be seeing or experiencing something. So if you find that a child is acting in an odd manner outside of their normal developmental stage, it's important also to keep a watch on that child. And if you feel that there's something that is just not explainable, look into it, because you may save their life, and as I said, multiple others as well. All right, I hope that this was of help to you, and definitely give me feedback about anything that you feel like I have discussed that you want me to go into more detail on. Give me your thoughts. Definitely follow me on my Facebook page. You can follow me on YouTube, as well as my website, drmonicadu.com. And I hope you all have an awesome day.